Well, good morning, everyone. I'm Debora Schoen, and I help coordinate programming here at Adrian's and over at Boardman sometimes. We're starting concerts back up. The Dukes and Duchess will be over at Boardman Road on July 10th, so that's something to look forward to. The new rotunda is going to be out shortly. It comes out, it's the beginning of June. It should be coming into your box any day, because we go through the half of June to the end of August. So be on the lookout for that in your mailboxes. And today we have Debora DeLucia, right?
Yes, you did it right.
DeLucia, to talk to us about Medicare. And she's with the Medicare Resource Group. And I just, she'll tell you more about it, but she is at no cost to you. So it doesn't matter what plan you choose. She gets paid anyway, but it doesn't matter. You don't pay her, and it's a free service that was, I believe, formed because Medicare is so complicated. So she joined this group, helping her mother, try to find out the best plan for her. And she goes, I want to help other people because it's very difficult to navigate and it's very complicated. So we really thank Debora for her time and her expertise and learning everything that there is to know about this process so that you can pass on that knowledge to other people who are signing up. So if you all, join me in giving her a nice round of applause.
So I will take my mask off now because I'm far enough away from everybody. So as she said, I am what's called an independent insurance consultant with Medicare. I don't work for Medicare and I do not work for any of the insurance companies. I get certified with each of the companies that do business in this area. And what that allows me to do is work for each of my clients because I can look at what their needs are and see what plan fits their needs the best. I can help guide them. I let them choose, but I help guide them. So, and I get paid by the companies I contract with or certify with. It doesn't affect what you have to pay in the long run. So I just need you to know that. So I try and do an educational approach so you understand how Medicare works. And there's my name and number if you didn't get my card. So I'm going to go over what is Medicare, who's eligible, how and when to enroll, the 4 parts, A, B, C, and D. They call them the building blocks of Medicare. I'll go over programs for people with limited resources and New York State EPIC, which is a New York program. So what is Medicare? It's federally sponsored, so it is national. Individual health plan providing coverage for medically necessary procedures and services. It does require co-pays, co-insurance. There are deductible payments that are the responsibility of the beneficiary. Or if some people are lucky and they have other secondary insurance through the job that they had, that they worked for many years. That it's part of their retirement package, they get that secondary coverage. So who's eligible? Anyone age 65 or older who has participated in Social Security, railroad retirement, or employees of the federal, state, or local government, or whose spouse has participated. So individuals under age 65 that have been awarded Social Security disability after they've been on disability Social Security for 24 months, they will qualify. Those disabled due to ALS, Lou Gehrig's, or individuals with end-stage renal disease.
I have a question for you.
Sure.
So number 1, it says anyone age 65 or older who's participated in Social Security. Is there a yearly limit, or you have to be participated like 10 years?
Oh, you have to have been
Working.
It depends on how long you've been in Social Security. So Part A will go over, will be free to most people if they've been on Social Security for at least 10 years or 40 quarters.
Okay.
Yeah. Okay. All right, so the 4 parts. Part A is hospital insurance. Part B, medical insurance. Part C are Medicare Advantage plans that incorporate A, B, and most often D in one plan. And then Part D are prescription drug plans which the government does not provide, but they do mandate that you have a Part D prescription drug plan. Okay, so we'll go over that a little more carefully. Part A is inpatient hospital coverage, skilled nursing care. To qualify, you must be hospitalized for at least 3 days to qualify for skilled nursing care. Then home health care, hospice, and blood. Part B is usually 80%. Medicare covers, you are responsible for 20%, or the secondary insurance you have will help with that. Physician services, outpatient surgery, some home health care, durable medical equipment such as walkers, wheelchairs, things like that, and blood. And this is the phone number, the 800 number for Medicare and Medicaid. So Centers for Medicaid Services, if anyone wants to write that down.
How easy is it to get through to them?
You usually are on hold for quite a while. Yes. So there is a local number for the Poughkeepsie building, and then there's the national number. I have both in my phone. Okay, so what is not covered by original Medicare? So outpatient prescription medications, which is why you must get Part D, routine dental care, routine vision care and eyeglasses, hearing aids, foreign travel, of course, because this is a federal insurance for our country, cosmetic procedures and treatments, and custodial long-term care. So if some people have a long-term care policy, you still need that because Medicare doesn't cover long-term care.
I have a question. If I wanted to move to Mexico, would my benefits be, I guess, available there, or do I have to come back to the States to receive that?
Yeah, you probably have to come back to the States to receive that. Puerto Rico, there are some things that you can get in Puerto Rico because it's affiliated with the United States.
And what about the other U.S. territories?
The other, you know what? I'm not sure. But usually they have their own program that you need to look into when you move to those states.
Even just visiting?
Oh, visiting is fine.
Oh,
And
okay.
visiting, what happens with Medicare, Medicare does not cover visiting those territories unless it's emergency and if you're in the emergency room. So if you're in the emergency room, then it would be whatever the deductibles are and 80/20. Okay, what does original Medicare cost? So most people qualify for premium-free Part A based on 40 quarters, which is 10 years, and they do prorate it. If you've worked for 8 years, if you've worked for 6, it's a percentage. You've paid into it through your FICA taxes. If you've worked fewer than 40 quarters, the monthly premium is $471. So they do, if you've worked like 8 years, you'll pay a percentage of that and going down. So the standard monthly premium for 2021 is $148.50. We won't know what the premium is for 2022 until October 1st of next year. They don't tell us, sometimes even later. If you are single and your income is more than $88,000, or if married and your income is more than $176,000, you'll pay more for your monthly premium. And in that sheet I gave you about Medicare costs, I gave you a chart, so you can use. The Part B premium, if you're already collecting Social Security at 65, will automatically be deducted from your Social Security check. Otherwise, you pay quarterly. If you have any questions on that, here we go. I have to say, my boss threw these in, so sorry about that.
What was your number again? 475.
6174. It'll come up again, trust me. Okay, yeah, so if you're already collecting Social Security prior to age 65, you'll automatically be enrolled in Part A and Part B. If you are still working and collecting Social Security and you're on your work health insurance, you can decline Part B and say, I'm not, because you don't want to pay for it if you don't have to, because you're already covered under your works insurance, you can decline it and send that back to them and say you just want Part A. Sometimes it's good to look at what Medicare will provide versus what your own insurance provides to be considered insurance that is, oh God, I'm missing a word. You have to have at least 20 employees in your job to have insurance that qualifies to be as good as Social Security, Medicare, so as good as Medicare. So people under 65 who've been on disability for 24 months will automatically get enrolled as well. And coverage begins the first day of your birth month, unless the birthday is the first of the month, you get it the month before. So those people are very lucky who are born on the first, because they get to start a month early. Okay, if you want to enroll and you're not collecting Social Security, you can go online to ssa.gov or call the 800 number. And they will either set up an appointment. Since the pandemic, they've been enrolling everyone over the phone, and you give them the information and then you fax information if they need anything. Otherwise, they just will sign you up and send you what you need. They are backlogged, so make sure you sign up early. That's very important. So if they say start the 3rd month before your birthday, start the 3rd month before your birthday if you can. So here's the chart. So the 7-month period to enroll is the 3 months prior to your birthday month, and 3 months after. So there will be no penalty if you sign up during that enrollment period. However, if you're not on what's considered the insurance that they accept, then you don't want a gap in your insurance. In New York State, as long as there's no gap in your insurance coverage, they will enroll you. There's no underwriting. There's no looking to see what your health is or what your health situation is. But if you have a gap, then all of a sudden they're going to look at your health situation. So make sure you don't allow a gap in insurance between your work insurance and Medicare. Any questions on that?
So 3 months before you turn 65 is when you have to contact Medicare.
You contact Social Security.
Social Security.
Yeah.
But Part A is automatic. You don't have to take Part B if you still.
Right. If you're still working, you do not have to take it. Yeah. But yeah, you will sign up. So that's what the new Medicare cards look like. They do not have your Social Security number on them anymore. They used to have your Social Security number on them. And there was so much fraud going on because of that, that they stopped doing that, luckily. Okay, so there is a general enrollment period. So say you missed that 7-month window, you can enroll between January 1st and March 31st each year, but your coverage does not start until July 1st. Failure to enroll in Medicare will result in a 10% premium penalty for one's lifetime for each 12-month period that goes by that you did not enroll. So I have some, I run into clients periodically. They're healthy. They don't feel like they need to enroll. They don't want to enroll. They didn't realize they're going to have a 10-month premium penalty. Yeah, a 10% premium penalty for each year they don't have Medicare. So the government wants us to have it, unless you're on unless you're still working. Yeah. So EGHP stands for Employer Group Health. Plan. You're right. Thank you. Okay. If a beneficiary or spouse are actively working, they may be able to delay. Okay, so actively working. All right, the Medicare beneficiary or their spouse is actively working for an employer providing the group health insurance coverage has at least 20 employees, or if they're on disability, the employer must have 100 or more employees to qualify. So sign up for Part B and Part D as soon as you can. Part B, you do have an 8-month special enrollment period to enroll without penalty. The sooner you enroll, the sooner your coverage will begin. And like I said, in New York, there's no underwriting, so don't have a gap. That's the only time there's underwriting. And yeah, enrolling in Part B also triggers your 6-month Medigap open enrollment period. So I guess 8 months is for your prescription plan, 6 months is supplemental plan. So Part C plans, which are the Advantage plans, this will confuse the heck out of you, so I won't even go there. If you have any questions about it, ask me. You only have 63 days to enroll in a Part D plan without penalty. And your plan will begin the first of the month following the month you enroll. Okay, so for example, unless you're in your initial enrollment period or your general enrollment period, but say you're losing employer coverage, say you're going to leave work in August, you want to sign up for a new plan in August. Your plan coverage will begin September 1st.
So what does plan B cover?
Excuse me?
Part D, what does it cover?
Part D is prescription drug plans.
Is it what?
Prescription drug, okay? And most often, if you sign up for a Medicare Advantage plan, the Part D plan is built into it. It's part of it. Did she say B or D?
D. Part D. What does
D,
part
she said
as in
D.
D. Yeah, D is in David, so that's the prescription drug coverage. Okay, so COBRA coverage may be an option as retirement health insurance coverage, but Medicare does not recognize COBRA as credible coverage. So you can use it until, while you're in that gap, if you need to. COBRA, it can be very, very costly though. It's usually not a wise option unless you have no choice because your time constraints didn't allow you to sign up. If you elect COBRA coverage, you must sign up for Medicare 8 months after leaving employer coverage. Yep. So you don't want penalties. Uh-oh. Okay, there's the question. I don't. Okay. So original Medicare only is Part A and B. Advantage plans are Part Z. Medigap plans, also known as supplemental plans, are just there. They're not A, B, C, or D. And then standalone drug plans are Part D. Any questions about that?
So what was the Medicap again?
Medigap are supplemental plans.
Right.
So if you get a supplemental plan, it does not include a prescription drug plan in it. So you would have to get a supplemental plan and a Part D plan.
So instead of doing like Aetna or Humana, you can take Part D.
Say that again?
Instead of taking Humana, are those related to getting an insurance like Aetna,
Yes, Medicare Advantage plans are provided by private insurance companies
that's
like,
Part D.
yes.
Oh.
So that they include Part D, most of them. So what are your costs? And they kind of go over in that sheet I gave you. So the hospital deductible for 2021 is $1,484 for each benefit period. So what's a benefit period? A benefit period is any period within 60 days. So say you go in for a broken leg or a heart attack, and then 3 months later you go in again, it's another $1,484. So the deductible is not like we know it in regular group health insurance. It's for each benefit period. If within that 60 days you go in for the same thing, or that's related to the same illness, then you don't have to pay the $1,484 again. There is a Part B deductible in 2021 of $203. And after you pay the $203, Medicare pays the 80%, the beneficiary pays the 20%. So there is no limit on how many Part A deductibles or cost share expenses. So in other words, most of our group health insurance has a cap on it. Once you've spent much money out of pocket, they will pay everything else. Medicare has no cap. So if you have a bad health year, if you do not have secondary coverage of some kind, you could be, might not be good. All right, so inpatient hospital coverage. So the first 60 days, the deductible is the $1,484. After day 60, 61 through 90, it's $371 per day. And it continues. So hopefully, luckily, I don't know anyone who's been hospitalized that long, but it can happen. Okay, skilled nursing care. So required daily skilled services. So skilled nursing care is not just custodial care or long-term care, like someone who needs help bathing, washing, feeding, cleaning. You really need skilled nursing care. So I have a client who has to get some kind of shot because they have a tumor in their stomach, unfortunately. So they can have someone come in and do whatever needs to be done to help him with that, which is so that's skilled nursing care. But if you need someone elderly and they need help cleaning or cooking, that is not considered skilled nursing. So hospital inpatient, 3 consecutive days or longer. And you can go into a skilled nursing facility. Generally, it has to be within 30 days after leaving the hospital. And it must be for the hospital treated condition or condition that arose, if you could read all that, while receiving care in the skilled nursing facility for the hospital treated condition. And they must be someone who participates in Medicare. So you always ask if your doctor accepts Medicare. That's very important. Not everybody does. Okay, so what is the benefit period? With Medicare, they cover days 1 through 20. Days 21 through 100, it's $194 per day. And after day 100, all of the costs you have to pay. So what does Part B cover? Part B helps with doctor's services. So your doctor appointments, outpatient medical and surgical services like outpatient surgery for knees, shoulder, clinical lab tests, durable medical equipment, diabetic testing supplies, and preventive services. So all preventive services on Medicare, like your group health insurance, are covered. So in fact, there'll be a list when you look at the plans of everything that they do cover. Okay, and here's the list of the preventative services. So anywhere from your annual visit to all kinds of screenings, colonoscopies. Colonoscopies, if they find a fibroids and they remove them, all of a sudden it becomes outpatient surgery. So you have to be careful. But you never know until you go in, right? You never know. But most screenings are definitely covered. And it's a head to toe preventative services. So any questions about that? So Medigap policy. So here it'll explain Medigap. They're the supplement. They supplement original Medicare. So you must have both A and B to have a supplemental policy. You pay your Part B premium and then you pay the supplemental plan premium as well. They are a little bit more costly than the Advantage plans. And they do not cover any extras like dental, vision, hearing, whereas a lot of the Advantage plans do supplement that for you, and they're all different. None of them are the same. Yeah. They do help pay some healthcare costs that original Medicare doesn't cover. So yeah, so that's what it means by a Medigap. That's why they call it Medigap. So those deductibles, There's plans that cover all the hospital. You don't have any cost at all when you go in the hospital. And sometimes they have co-pays for the doctor, sometimes they don't. Sometimes they cover the Part B deductible, sometimes they don't. So you have to know the plans. Medicare will pay its share of the Medicare approved amounts for covered healthcare costs, and your Medigap policy pays its share. And a Medigap policy covers one person. So again, Medicare is all individual. So there's no family plan, there's no couple plan. And what plan may be right for one person may not be right for the other person. So it's all based on the doctors you see and the prescriptions you have. So Medicare supplement plans, again, standardized insurance plans designed to fill in the gaps in Medicare Part A and Part B. And not to confuse you, they have letter codes, A through N, with some letters missing in between. So it's so funny because Medicare is A, B, C, and D, and now these are A, B, C, D through N. You know, it's like, what? Hey. So all plans cover a basic group of benefits, and they each have a different part of the gap that they're covering. So you really need to know the plans. They are federally mandated. All the Medicare plans, supplemental plans, are federally mandated, which is great because when they're federally mandated, it doesn't matter what company you go through. They're gonna, plan A with one company is the same as plan A with another company.
And you have more than one?
No,
You just get one of the A through whatever?
yeah, you just pick one. Yeah, you cannot have more than one plan. I know people want to have an Advantage plan and a supplemental plan, and you cannot do that either. Okay, so health plan options approved by Medicare. So now we're talking about Medicare Advantage plans. So Medicare Advantage plans, while you're healthy, is a good way to go while you're, but everybody's different. It is still part of the Medicare program. They are run by private companies. So when you have a Medigap plan, Medicare is your primary. When you have a Medicare Advantage plan, the insurance company is your primary. And then, so they make the decisions on whether they cover something or not, but they have to at least provide what Medicare allows. They have to at least give you what Medicare allows.
Your
Okay.
selection of whatever group you go with, does that depend where you live, like Dutchess County versus Westchester County?
Yes, so in other words, Aetna has plans in Dutchess, Orange. I mean, some of their plans will be the same for some companies, for some counties, but Westchester is a whole different territory, Westchester and Rockland. So you have to know what plans are good in your county.
So say I have Fidelis Care already.
Mm-hmm.
Would Part C already have like a Fidelis Care as you transition to Medicare?
You
in
can
Dutchess County?
stick with Fidelis if you like. Yeah.
But typically what we are.
What you would like to do to figure out what plan makes the most sense for you is really look at what prescriptions you're on, if you're on any, and what doctors you see, because not all the plans are accepted by the doctors. So if you have certain doctors that you know and love and you've been seeing for a long time, that's the first thing you check. And then you check your prescriptions and see how they're covered on the plan that accept all your doctors. That's extremely important because Part D is really interesting. Now, when I go over that, you'll see what I mean. Okay, so yeah, when you have a Part C plan, if they are an HMO, you must use their network doctors. If they're a PPO, they do have a network, but you can go out of network. Your costs out of network are just a little higher. So for an example, an in-network doctor might be $45. Your primary might be $0. Specialists out of network could be $75, but in network 50, 45, or 50. So it depends on the plan. And it does say types of plan vary from county to county. So here we go. Yeah, the HMO, the PPO, there's a point of service plan, special needs plans. So special needs plans are for those who are either in some kind of critical condition, or special needs, dual needs fall under special needs as well. People who are on Medicare and Medicaid at the same time. All right, when and how you can enroll in a Medicare Advantage plan. So during your initial enrollment period, or during the yearly annual election period. So each year, the good thing about Medicare, each year you can review your health situation and you can switch plans. And also the plans change from year to year. So October 1st of every year is when they roll out their changes and you receive an annual notice of change. And then you say, uh-oh, the thing they're changing is what I like the most about my plan. So then you may want to look for another plan at that point. So the annual enrollment period is October 15th through December 7th every year. And when you enroll during that time frame, the new plan doesn't start till January 1 of the following year. The other times to enroll is if you move to a different county or state, or you qualify for extra help. If you're on extra help, you may change plans every quarter. If you have any questions about that. See, I told you, he threw this in a lot. This was not there last year. All right, so drug coverage. So to get a Part D plan, you must be covered by Part A and or Part B. So you don't have to have A and B to qualify for Part D. Come on in. Plans are sold by private insurance companies and require payment of monthly premiums. Each plan covers a group of prescription medications. Prescriptions are on what's called a formulary, and every company has their own formulary. They're not all the same. Plans and formulary lists can change annually. So when you get your annual notice of change, that's something else to check. Did my prescription drug coverage change tiers? Do they still cover the drugs that I'm taking? Always good to review. So it's Part D. It took me a long time to really understand. It's quite complicated. So there is an annual deductible. Some plans have less of a deductible than others, but the yearly deductible this year, the most it can be is $445. And so that's what you would pay before they cover any of your prescriptions. Some have no annual deductible, so you have to look and see what your plan or what the plans offer. Initial coverage level, you pay a copayment and your plan pays its share for each covered drug until their combined amount equals $4,130. So that means once what you've paid for your copays and what the company has paid for your drugs equals $4,130. If you're on expensive drugs, you fall into what's called the coverage gap. Oh, apologize. I thought I turned that off. Okay, sorry. Okay, so when you're in the coverage gap, you have to pay 25% of the cost of the drug. And that can be quite a high amount based on whatever prescriptions you're on. The people who have the hardest time are people who are diabetic because they are on quite expensive medications. And that can happen every year. Once you've spent, now they only go by what you've spent, but they do start from the very beginning, what you've spent all year. Once you've spent $6,550 out of pocket, then your coverage gap ends. You end up in the catastrophic phase. And at that point, your drug, your copayments go very tiny, or 5% of the cost of the prescription based on whatever the drug is. Any questions on that one?
I have a question. Say you're on a variety of drugs and you're trying to find out what company can give you, I guess, the best cost for you.
Right. So that's something that I do for my clients, but you can go into Medicare.gov,
I did.
okay, and you
It's
can
there.
put your prescriptions in.
Yeah, I like the way they do it, but it's really time consuming because you got to put in your drug and they have all these drop downs. Then you have to pick your pharmacy and they tell you your pharmacy and how close it is to your house, blah, 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 blah. And it's great, but I'm just looking for the cost.
Right.
Because-
It can be very confusing, and at times it's not accurate. That I found out. So unfortunately, yeah, because I was looking up a prescription for someone and they were telling me it cost $20,000, like the retail price was $20,000. And I think 2 weeks later, I looked again and it was $500 and something was the retail cost. So what I do then is I start Googling and I start saying, what is the retail cost of this particular drug or the average retail cost? And I say, okay, something's not right. So
Yeah.
then you have to do some legwork to figure out.
And you probably have
What's
to have
wrong?
more than one pharmacy if you're trying to save money.
Well, usually you stick with one pharmacy and you try and go with the plan that has your pharmacy as a preferred. Some companies, they have no pharmacy preferred except mail order. So you have to go mail order through some particular companies like United. Well, I'm not allowed to talk about companies. Can't do that. This is educational. Okay.
The thing that I know about Part D is that I know somebody who is relatively healthy
Okay.
and they didn't opt for Part D because they never really had medication. But then something happened and they really got stuck with, like, they had to pay out they really had to pay a lot because they finally needed it. And if you didn't have it from the first time that you started, you get penalized very, very hard.
Yes. You get a 1% per month you go without it of the annual cost. So the annual cost, I think right now, the annual average of a Part D premium is $30-something. So it's about between 33 and 34 cents per month that you go without it. So if you go without it for 10 years, that's 12 months times, that's 120. It does add up. If you only do it for a year or two, it's not too bad, but that stays with you for life. Any of these penalties for not signing up, they don't go away. It just gets added to the cost of whatever the premium is for that prescription drug plan that you do finally get.
So this brochure that you just gave us, will that help if you opt out of Part D?
You can't opt out of Part D,
Okay.
but I will explain EPIC in a little bit. I'll go over it briefly. Okay, so here it is. So the higher premium if you wait to enroll. If you have credible coverage through your group health plan, you're okay. If you're on extra help, you don't have to pay the high premium because you're already being subsidized, and a lot of times you're on extra help due to certain situations, so they're not going to charge you a higher premium when you can't pay it anyway. But you will pay the penalties for as long as you have coverage, 1% of the base beneficiary premium. And that amount changes every year. You can visit Medicare.gov for the current figures, but right now it's between 33 and 34 cents a month. Okay, so extra help program, financial assistance available for people with limited income. And that eligibility is determined by the Social Security Administration. So I do have a chart that tells you for 2021, where does your income fall and do you qualify? I can pull that out after the meeting or after the presentation. It can reduce or eliminate monthly premiums. It can reduce your prescription co-payments and provide a continuous special enrollment period. So that it's actually every quarter now It's not every month anymore. Okay.
Deborah, that extra help, is that only applicable if you are 65 or older or on disability?
Yes, that particular one. Yeah. Okay, so what are your coverage choices to try and get some clarity? So you can have original Medicare, I mean, you have to have original Medicare, Part A and Part B, and then you can go with a supplemental plan and a Part D prescription drug coverage. That's one way to get covered. Or you can buy a Part C plan. It combines A and B and D all in one plan. There are some Part C plans that only have Part A and B, and those are for people who have in their retirement plan a Part D plan that they're able to continue. And that happens, I've seen that only once, but there are a few companies that do provide a Part D plan for their employees. So I see someone writing. Tell me when you're ready, I'll switch to the next screen. So these are your options.
When you go back to that penalty, does that apply for someone who's still working?
No, as long as you have credible coverage, to have credible coverage, you have to be working for someone with at least 20 employees.
Okay.
Okay. All right, so this kind of breaks down the enrollment periods again. So the annual enrollment period is that between October 15th and December 7th each year. They started 2 years ago an open enrollment period. Say you change plans or you get in a plan and it starts in January 1st, and by the end of January or the end of February, you decide that plan didn't work for you. It's not what you thought it was. You can change plans. You have that ability to change to another Advantage plan between January 1st and March 31st. So there's actually 2 enrollment periods that you can use. Then there's special election periods. If you move out of the service area, you're eligible for low income subsidy, or you leave your employer coverage, that's a special election period. And usually if you sign up 1 month, the plan becomes effective the following month. And then, of course, the general enrollment period, which we talked about, if you miss your initial enrollment period. So, is anyone confused yet? Yeah. It's definitely a lot to take in. So, there are secondary coverage options. So you can have Medicare and Medicaid. Those work together. If you are retired military, TRICARE for Life, military retirees and dependents, and you can have Medicare with TRICARE. Federal and state plans for retirees and dependents, and then employer group health plans. There are some companies that still offer retirement plans, not too many anymore, but there are some. And then there is New York State Epic, which I had some flyers in the back or brochures. Epic is a prescription drug program to help people with the cost of their drugs. There's a sliding scale based on your income. You must have, if you're an individual, your income has to be below $75,000. If you're a married couple, it has to be below $100,000 to qualify for Epic. Once you sign up for Epic, it does help you if you're on prescription drugs with your copays. The other thing that Epic will do, I always have clients, if they qualify, sign up, because it will provide you with another enrollment period. So say you start with a Medicare Advantage plan, you like the plan and the way your health is, it's going to work for you. But then all of a sudden your health changes, you're diagnosed with cancer, or you have a heart attack or something very severe that's critical, and you may need to switch to a supplemental plan because your costs, the costs of the hospital and all the radiation treatments and the chemo is going to outweigh the money you're saving with the Advantage plan. So then you get a supplemental plan. But Epic is only within New York State. So Yeah, there we go. That kind of goes over it a little bit. I do have some flyers about Epic too, that, that goes over it a little more. So if you have any questions, there is a fee plan. So if your income is very low, which seems ironic that you pay a fee for Epic, it's usually free. But if your income is very low, then you're on a fee plan, but they will cover the cost of your co-pays right away. You know, your co-pays will be low from the very beginning, and they will pay your drug premium as well, your Part D premium. Okay, so where can you get help? So Social Security Administration, SSA.gov, Medicare.gov. And that URL is my boss's URL. It's his website. But it's nice, you can go to the local office of the aging for some support as well. And then that's it. So that's the PowerPoint. So any questions? Or would anyone like to set up a time to meet with me just to go over one-to-one to understand it a little better? Yes? Okay. I am happy to assist. So it's actually, that is it, guys. But how can I do this? If you would fill out the form that you have and just let me know you'd like a phone call, or you'd like me to call you, or when your sign-up period is, I'd be happy to help. I'll collect them.
So both my wife and I are 2 years away from being
Okay.
61, so we wanted to get one.
Just kind of get a heads up on what this is all about. It's kind of overwhelming, right?
Can you go back one screen?
What would you like?
One screen back was, yeah.
Okay.
Like, people, are all Medicare, like, I can't help it, like, when I ask them questions, like, I don't know, I just do this, it works for me, and,
Yeah.
it's like,
It's so individual, and it really is based on your health. Like I said, the doctors you see, and any prescription drugs. And if you're not on a lot of prescription drugs, you're pretty much, you'll take the plan that makes the most sense or the most cost effective.
so generally, it's like, so I work for a large company, but we have health insurance, I mean,
Okay.
I use those things, and, it's like this kind of
Okay.
so I do have to pay now, as
Right.
working on paying so much down the paycheck, it goes to
Your insurance.
my insurance, and then when I retire, I'll be able to continue that insurance. And premium, so,
Right. You may at that point want to compare what you still have to get Part B of Medicare. And then you may want to compare what your plan is providing versus what a Medicare plan will provide, one of the other plans will provide.
So you have to take part of it.
You have to take Part B, not while you're still working, but once you retire.
Or once you're retired at 55.
65, yeah. If you retire at 65. There's a lot of people working past
And what
65
about
these days.
the age when you 67, 60, that's the date you have to.
Yeah, right. If you should always sign up for Part A as soon as you turn 65, because Part A doesn't cost anything, and it will just help you, and it will help your company as well, because even though you're on their insurance, that Medicare Part A will fill in for whatever the insurance you have won't cover. Okay.